Hello, everyone. It's good to be with you today. Today, I'm very, very happy to be able to interview Dr. Brandon Smith, who is a dentist who takes an approach that is a little different than common dentistry practices. And he's very well acquainted with the work of Dr. Weston A Price and the nutritional aspect of development, myofascial development, and all of that. So I'm really excited to be able to present you with this pre-recorded interview. I hope that you will learn a lot from it. I'm asking for you to like, subscribe, and please do share. And if you'd like to buy us a glass of raw milk, that would be great too. There's a tab for that. Any questions that you might have, please do post them in the comments because we will be coming back for a second part. And we also will be interviewing a couple of other biological dentists and related people in related fields. So we'll certainly want to try to get your questions answered. Feel free to go ahead and ask. So with no further ado, I'm going to go right here. And welcome, Dr. Brandon Smith. So happy to have you.
Thank you, Maureen. Happy to be here. Thank you for having me.
I'm really, I'll have to say, and I'll say this to the audience, that I'm familiar with quite a few different people, including a local biological dentist who I have used. But I was so happy to meet you just a couple weeks ago at Homesteaders of America and talk and see where you're coming from and that we're very much on the same page. And I'm just excited to actually have a conversation with someone else who understands where I'm coming from, where Aaron and I, what our thought processes are, and someone who understands the work of Dr. Weston A Price. So with that, Dr. Smith, I'm welcoming you, and I'd love for you to introduce yourself and tell us a little bit about your experience and what brought you to where you are.
Sure. Well, thank you for the introduction. Brandon Smith. I own Tuscarora Dental in Martinsburg, West Virginia. I own it along with my wife, Dr. Angelina Browning. We have a daughter named Georgia. She's 2 years old. We are expecting with another one on the way, a little boy.
I didn't know that. Good.
And we have 2 golden retrievers named Johnny Cash and June Carter. They're comfort dogs in our practice, and they are service trained to sit with patients and provide them just different ways of easing their anxiety during their treatment.
That's really neat. And looking through your website, I saw quite a few photos of the dogs on patients' laps and making them happy and calm.
Yep. And they're available for any patients that request them. Let's see. So Dr. Browning and I, we consider ourselves physiologic dentists and biological dentists. So physiologic is more of kind of a macro approach of how the oral condition contributes to the greater physiology of the rest of the body and vice versa. So it deals a lot with alignment, with lymphatic drainage, with airway in terms of volume of airway, and inflammation for that matter. Inflammation as it relates to the macro structures, the lymphatic tissue of the head and neck, and how that can affect development, proper growth and development. And then biologic dentistry is an approach that focuses on more of the micro aspects of the same regard. So it has more to do with biocompatibility and consideration of the types of materials that we use and how each individual's body reacts to those materials. So one, really important component of that is biocompatibility testing. So we have a blood test that we can conduct for our patients that tests their antibodies against just hundreds and hundreds of dental materials and gives us a rating of how reactive each patient will be and their individualized profile so that we can, basically create a list of materials that are safe for use with the patient and materials that we should avoid. using with them.
That alone is, I think, super important, and people need to be aware of that. As I had shared with you when I met you, I'm having dental implants done, and my implant doctor, when I brought this up to him, kind of poo-pooed it, but we have had since another conversation. But I just said, well, let's do titanium because everybody I know does titanium. And later I realized that was a bad idea.
Mm-hmm.
And I wish that he were more informed, because I had a blister, a bad blister, but a blister. And it was 7 weeks before I could wear a full shoe. It didn't heal. And that was extremely unusual for me. And so I suggested to the implant doctor that maybe there was a compatibility problem or something. But that's something that people, especially with the popularity of dental implants, should probably think more about.
Sure. I mean, everybody reacts to different materials differently, and that's the importance of biocompatibility testing. I'll put it that way. But even whenever we have a reaction that's happening, far away from the site of the surgery, for example, it poses a question. Are these two things related? And I mean, while I do think one way to look at it is, okay, let's look at the most recent changes, right? Like what happened between now and whenever, or since the onset of those symptoms, and prior to that, what happened differently? Absolutely, I think while immune reactions to titanium are not a common thing, I absolutely accept that there are certain people who are going to be reactive to those metals. I actually just walked up here out of a consult with a patient who I'm planning on doing some titanium implant removal for her, because she is, very, she feels very strongly that she's had some health problems that have arisen recently after having those implants placed, and for her the most logical thing to do is have the implants removed. We did biocompatibility testing for her, and we identified a material that we're going to be able to use that's completely metal free for her partial, that we're going to use to replace those back teeth that are going to end up the implants that are coming out. But I think that in any circumstance, it's really, what are the individual's goals? You know more about what you're experiencing than I do from an outside perspective. And so, whenever somebody comes to me and, in your circumstance, with a problem, it's not about dictating based on my life experiences what's going to be the best thing for you. It's a conversation that needs to be had with the patient and a mutual.
Yeah. Well, just the fact that you offer the biocompatibility testing, it seems like that, in my experience now, I would suggest that would be very, very beneficial. So I'm not in a position to have mine taken out, but I was interested that you brought that up.
Yeah. And I think that biocompatibility is one of those things that everybody can benefit from, because everybody's completely different. So
Yeah, good. Now your wife, you mentioned, started developing, we're completely shifting here, but she started developing some inflammation issues with high CRP and ANA markers. If you want to explain that briefly so people understand.
Yeah, totally. So CRP is C-reactive protein. It's just a blood test that measures overall body inflammation levels. And, that was obvious enough. She was having, she developed sensitivities to foods that she never had sensitivities to before. But the ANA is anti-nuclear antibody, and it's more of an indicator of autoimmune. So self antibodies, right? So there were indications that she had some sort of an autoimmune thing come about. And at the same time, she started developing very severe sensitivities to what we later determined to be dairy and gluten, specifically cow's milk, which ended up after a more specific biocompatibility food test, ended up being a protein allergy. So not even like a lactose intolerance.
Okay.
But throughout the entire process, I mean, we first sought out the hospital system, right? And the hospital system, it really does not have a good, in our experience, did not have a good method of getting to the bottom of the autoimmune symptoms that we were experiencing. And through the recommendations of some friends who are also very familiar with Weston Price, just in an unrelated way, we started seeing a functional medicine doctor.
Okay.
And they did the food sensitivity testing. They suspected some form of Hashimoto's, which is a thyroiditis, an autoimmune to thyroid. But she ultimately ended up getting her symptoms controlled through diet alone, right? And that really sparked something in us, and realizing that there's more to getting to the bottom of these problems than what the conventional American medical system would lead us to believe. And so around the same time in our professional capacity, we bought our first practice right around that same time. And, we did suspect that exposure to some of these dental materials could have been what triggered the initial symptoms that she had. And also right around that time, we became affiliated with the Las Vegas Institute for Advanced Dental Studies, which is where we got introduced to physiologic dentistry. The philosophy of the Las Vegas Institute is largely built on the philosophy of Weston A Price, in identifying that a lot of the issues that we have with the oral condition and pain disorders specifically that occur downstream really result from early nutrition and the types of things that we're exposed to early in life, and the types of things that kind of happen downstream whenever the right switches aren't being switched early in life.
Okay.
And so there was a gentleman named Jim Gary who was affiliated with the Las Vegas Institute up until his death, and he did a lot of work in piecing together Weston Price's work and bringing it into a more contemporary realm of what we're seeing today in terms of a broader scope of health conditions. But really, it comes down to Weston Price's philosophy as being the backbone of our training.
That's amazing. I'm so thankful that this even exists. I was unaware until you told me about the physiological dentistry aspect. And Dr. Price's work used to be featured in dental schools up until about the late 80s or early 90s. Dr. Ralph Meinig wrote a book titled Root Canal Cover-Up. We're not going to talk about root canals today. That's a topic in and of itself. But in that, he faults the current dental system for no longer teaching that. And I am going to, just as an example, I'm going to show first this slide. Dr. Price traveled the world having made the mental connection between dental health and physical health, and then the further connection with food. And so here is just an example of how our faces should develop and how people's faces used to develop. And that's all nutritionally influenced. As we can see by this slide, he visited the Outer Hebrides Islands in the early 1930s. And here are two brothers, one of whom remains in the village and the other who has left the village and is consuming what Dr. Price called the foods of modern commerce. And you can see that the brother on the right is his teeth are not looking real great. Dr. Price found that, first the teeth would go and then the bodily function would decrease. And then you look at Francis Pottinger's work, and you see that it's a multi-generational thing. Nutrition counts even prior to conception, even probably prior to your mother's conception. And that's, I know, the area of interest where I want to go with you right now. So,
so yeah, absolutely. Weston A Price's work really focused on nutrition, right? Mm-hmm. So the images that you showed, I feel like one of the most important things that we see there is the differences have to do with microbiome, right? So we saw what was obvious from those pictures was the gentleman on the right in the picture of the two gentlemen. His teeth were broken down, right? He had tooth decay. There's a narrowness to both of their faces, and I think that should be noted as well. Yeah. But whenever we look at the indigenous gentleman from the first, or child even, from the first slide, we see a big, broad arch, beautiful teeth, no apparent decay. Right. Now, Dr. Price attributed the whole picture to nutrition, and to a certain extent, that's an oversimplification of what we're actually seeing. So what the European diet is high in is a higher amount of in that time it was grains, right, and corn, and what that really ultimately is fast carbs, sugars. Sugars feed bacteria. Yes. If we had to guess what the first gentleman's, the indigenous gentleman's diet was, it would not be nearly as many grains. It would not be nearly as many processed grains, meaning ground grains as the people in the second slide. Yeah. But even beyond that, there is the role of inflammation, which is, it's a similar story, but is a more modern story to what those pictures represented back in the time that Weston Price took those pictures. Mm-hmm. The inflammation these days, a lot of times, is mediated by not just the nutritional content of the food, but the chemicals and the pesticides and everything that's being added to the foods. Yeah. These things that we're putting on the foods today, the pesticides and for that matter, the unnatural sources of fertilizers and that sort of thing, it never really gets fully washed off of our vegetables, and not to mention the degradation of the soil quality and how our foods just don't have the same nutritional content as they had before. These things that we're putting on top of the food that we're now consuming along with the food are causing an additional layer of inflammation. And we can talk a little bit more about that, but physiologic dentistry really focuses on the effects that lead to improper airway development. Mm-hmm. And that was a lot of what Weston Price also focused on. With regards to prematernal nutrition, we all are aware, or many people are aware, that folic acid is something that is really heavily recommended that new and expecting mothers supplement with. It's going to be in nearly every prenatal vitamin that you take. But for example, once again, getting back to the biocompatibility and how everybody's different, there's a genetic mutation called the MTHFR mutation. Now, the MTHFR mutation can actually affect the way that our body processes folic acid. Now, let's get back to the importance of folic acid. So folic acid deficiency in pregnancy has been associated with certain connective tissue disorders let's see, even autism. There have been connections with autism in folic acid deficiency. Right. And so, what the studies are showing are that the mother's levels of folate or folic acid are heavily associated with a higher incidence of these types of problems, even if the mother is deficient prior to conception.
Okay.
So the ideal, so let me back up. I feel like I'm getting too far in here. So even a mother's inflammation or nutritional status before pregnancy can create a ripple effect. It can have major implications in the child's or young adults, or as that child grows up, the adult's health. So each of the stages, child to young adult to adult, do have graver and graver implications for their overall health.
Yeah.
So the recommendation is that women planning to get pregnant should be supplementing with folate or methylfolate, ideally 8 months or a minimum of 3 months before even planning to get pregnant.
And just a note is that methylfolate is the more absorbable form of folate. And can you just, in a nutshell, also enumerate where we can find natural sources of folic acid?
Sure. So what the important discrepancy here is that we don't want to be supplementing with folic acid. Folic acid is bad. So this MTHFR genetic mutation is a mutation that is present in 70% of women. So that means that 70% of women have a mutation that actually inhibits their ability to metabolize folic acid correctly into the active form of methylfolate or folate. So folic acid is what is put into the supplements. Our body does not utilize folic acid. Our body can absorb folic acid, but it has to be converted into methylfolate in order for our bodies to actually utilize it. And this is vitamin B9 if we're talking in layman's terms. Not only that, so the MTHFR mutation prevents the conversion, or it's just a lack of hardware that converts the folic acid into folate or methylfolate within the body. So what's happening is mothers may be supplementing with folic acid. They're absorbing it into their gut. Their blood levels are showing ideal levels of folic acid, but their body's just not able to utilize it because they're not converting it appropriately into its active form.
Right.
Not only that, the folic acid can actually bind to the sites that the folate and methylfolate are supposed to be binding to and take up that space without performing the appropriate activity and prevent the real folate and methylfolate from binding to those sites and providing their benefit. So folic acid in people with MTHFR can actually increase the risk of these connective tissue disorders and possibly autoimmune, or not autoimmune, autism.
Wow. And maybe even just make many more susceptible to other causes for autism.
Yes. And so you were asking about the, sorry, I don't want to go too far off. You were asking about natural sources. So certain legumes and leafy greens are going to be good for getting the active forms of folate. So that would be edamame or soybeans have the highest measured levels of folate naturally. That's going to be with a good quality soybean. Lentils, asparagus, spinach, broccoli, all good natural sources of folate, but they do need to be coming from a source where the nutritional content of those foods is going to be maintained.
Now, and a note on that is that with soybeans, they can be very antagonistic towards the gut because they are the highest legume for phytic acid, for one. Yep. Very, very high in estrogens. And from a traditional food standpoint, they would always have been well fermented. Does the fermentation increase the bioavailability? When we say fermentation, that means miso, that means an actual fermented soy like a tamari or a shoyu or a natto or something like that. So does that increase as fermentation often does?
I don't know the answer to that question. So my suggestion would just be to be careful in your selection of where you're getting your soy products from. But I agree with you. I do recognize that soy tends to be inflammatory and estrogenic as well.
Yeah, but it doesn't have to be if you take the right forms. So, okay. Yeah, but otherwise lentils are very high.
Mm-hmm.
And I'm trying to remember what else you mentioned.
So asparagus, broccoli, spinach. Yeah, all great sources.
Okay.
Additional benefits to all of them as well. So.
Okay, good. Especially when they've been cooked and served with butter or olive oil or something. Yeah, that's really interesting. And I don't generally recommend just supplements.
Mhm.
I generally recommend food as supplements. And there
Yeah.
actually are a couple of food-based supplements out there that women can take.
Yeah.
Um, uh,
And recognition that food is medicine absolutely is the best way to approach this. But, we also need to recognize the fact that access to these high quality food sources is not something that's really apparent for people, right?
Yeah.
There may be people who have a hard time accessing good sources of these foods. All the more reason for us to be doing everything that we can to expand it. But, I think that the source of these foods is going to be incredibly important. And
yeah.
if all else fails, I think the supplementation is absolutely something that it's going to be more important to get it in some form. Yeah.
Yeah, I would agree, especially seeing the kinds of problems that people are having with their children. Yeah.
Yeah. And in our wheelhouse, so I didn't really make the connection of where those connective tissues disorders with MTHFR arise within the scope of Weston Price's teachings and what my work is. Just to bridge that gap, whenever we have a connective tissue disorder like the one that's induced by MTHFR, or at least through the reports that I'm having from my functional medicine doctors that I refer my patients to, is that whenever a mother has the MTHFR genetic mutation, she's seeing a much higher incidence in their children having tethered oral tissues, meaning tongue and lip ties. Now, lip ties do limit the mobility of the tongue, and the tongue is very important for proper development of the jaws and the midface in particular.
Yes.
So if the tongue lays low in the mouth, which if the tongue is tied low to the mouth with a strip of tissue that extends toward the tip, it's going to take more energy for the tongue to assume a posture that's up toward the roof of the mouth than it is down toward the floor of the mouth.
Right.
Now, our upper jaw is actually formed by the shape of our tongue. Our upper teeth, or the ideal shape to that upper arch, is the shape of the outside of the tongue. And that comes through just normal resting posture. It can also come through that continual swallowing that we do, of swallowing our own saliva throughout the day or swallowing our food. Our tongue goes up and it presses against the tongue side of the teeth. The growth centers of our upper jaw are everywhere. That upper jaw is very malleable compared to the lower jaw.
Okay.
There was a doctor named Wolf. I don't recall his first name, but he developed a law of bone remodeling, and it says that a bone's form will follow the function within which it's placed. Meaning, especially that upper jaw that is malleable, if we have forces applying in one direction, the bone is going to grow to accommodate that force.
Okay.
And it'll grow away from that force. Now, the force of that upper jaw has both the lips and the cheeks. There are muscles in there. So we have the orbicularis oris around the lips, and we have the buccinator muscles inside the cheeks that are constrictor muscles that are pulling everything in. And our tongue is supposed to create kind of an equal but opposite force, pushing things out. If the tongue is tethered low in the mouth, then that upper jaw doesn't have that force pushing out the way that it is, and that results in a constricted arch and crowded teeth, less space inside the mouth for the tongue, okay? Because that tongue is tethered to the lower jaw. Now we have a smaller upper jaw that is supposed to function like the lid on a shoebox. It fits right outside of the upper teeth fit on the outside of the lower teeth. But once we start shrinking that upper jaw, that lower jaw has to swing back further into the arch to get the back teeth to couple. What happens whenever we're swinging that lower jaw further back is it carries the tongue with it, and then we start losing space back in here where we're supposed to be breathing.
Mm-hmm.
Now, add to that the tendency for children to be exposed to allergens in their foods. So a lot of processed grains that are highly inflammatory, the pesticides and the all the unnatural things that are coming along with that are causing chronic inflammation in the children.
Yeah.
Chronic inflammation leads to swollen nasal mucosa, so stuffy nose, right? These are some of the first places that we tend to see it in kids is they get a stuffy nose, they get swollen tonsil tissue, swollen adenoid tissue, right? So we have tonsils on either side of the throat in the airway, we have tonsils on the tongue, we have adenoids up above, and it forms a ring of lymphatic tissue in the airway called Waldeyer's ring. Now, if we have that chronic inflammation in a child, those are the first places, especially if those inflammatory substances are coming through their mouth, that's the first area that's going to get constricted and inflamed. So we see their airway starts reducing this direction. Their sinuses are inflamed, so they can't breathe through their nose anymore. So they have to breathe through their mouth, and they develop an open mouth posture.
Mm-hmm.
Takes the tongue off the roof of their mouth and further constricts that upper jaw. Now we're getting back into Weston Price's theories of how nutrition affects jaw development. But there is a cascade of things that tend to happen, and they tend to spiral with one another. One thing makes the next thing worse, right?
Yeah.
So we may see obstructive sleep apnea in children. It's not something that's uncommon anymore. It's becoming more and more common over time.
Yeah.
And then as the child grows up, they develop obstructive sleep apnea as an adult, which leads to higher risk of heart disease and just about any metabolic disorder, because it leads to a metabolic crisis whenever they're sleeping. It leads to adrenal fatigue or hyper activity of their adrenal system, because their fight or flight system never actually gets a chance to shut off because they're choking in their sleep. Leads to high cortisol levels, which puts additional stress on the heart. All these things can be prevented. And we're finding this now, right? We're starting to put these pieces together because we're having these generations aging up, and we're able to look back and say, okay, these are where we're starting to see this cascade of problems starting.
Yeah.
And that's why I think that things like tongue ties that we never really heard about before are becoming more of a mainstream thing, is because those tongue ties were present 30, 40, 50 years ago, but they weren't given the gravity of their importance that we're giving them now, because we're now seeing how those children are growing into adults and how it's leading to health problems as the children grow older.
That's it's especially interesting that we're talking about this now, because my children, as far as I know, don't have any tongue ties or anything, but I have some grandchildren with one just had tongue ties. She's 3 months old. She just had her tongue ties snipped, and the doctor said they were some of the worst he'd ever seen. And I didn't have an explanation for that, and I wanted to. And I have another grandchild who chronically has swollen lymph nodes in his neck, and they eat a very, very good diet. But here again, we're talking, what do you call it, second or third generation, because I grew up on a highly processed diet.
Yeah.
Our children grew up on a very good diet. Mm-hmm. And then our grandchildren mostly are growing up on a very good diet. So it's perplexing to me to see these problems, but I understand that both parents have an influence genetically.
Absolutely.
Yep.
And not just that. I mean, the folate
Yeah.
supplementation is recommended for the father as well. Those things can be passed
Oh,
through the father. I mean, they're. I don't know how. I don't fully understand the physiologic pathway, but they are putting those correlations together that folate deficiency in the father can lead to similar problems.
wow. And in both cases, here, sons-in-law would have grown up on a very deficient diet.
Yep. And so
So,
this gets into the realm of, a new realm of genetics. So I think that this is significant, right? We know the father contributes sperm, which up until recently was just recognized or understood as raw genetic material, right? Where they supply the raw genetic material, the mother provides the nutrition. But this concept of folate having an implication in father's folate levels having an implication in the child's health opens the door to a conversation about epigenetics, which I think is absolutely fascinating.
Yeah, it is. I often bring that up.
Yeah, and our ability to actually turn on and off genes through methylation or other means to activate or inactivate genes. And it's a way for, just evolutionarily, theoretically, to be a little bit more adaptable to the environment than what raw genetics would allow us to.
Okay.
And so it's a very fascinating field of research right now that has a lot of implications in what we're talking about here too.
Yeah, it really does. And epigenetics also goes into traumas and just all of that, which in the last few years, I'm learning more and more about
how things can get passed down through generations, right?
Yeah, and how things are changed. But not delving into that area, let's talk about what are some things that we can do now when children are born and they have tongue ties.
Absolutely.
Or they're having, their palates are too narrow. What can we
or the inflammation, right? What are the early signs? So my daughter, who was born 2 years ago, whenever she was born, my wife and I, because we've been turned on to all of this, noticed immediately that she had a tongue tie and buccal tie and lip ties. She had ties everywhere. It was not recognized in the hospital. We even spoke with the practitioners in the department that we were in, had a pediatric dentist come in. They evaluated her, and none of them had been adequately airway trained, in my opinion. They did not recognize that this was a problem. At the same time, my wife was having a terrible time with breastfeeding, right? So that altered tongue mobility in children, or deficient tongue mobility, can make a latch much more difficult. Now, that's not to say that every child with a tongue tie is going to have a difficult time with a latch, but by the numbers, it's more statistically likely that a child with tethered oral tissues are going to have a hard time. The mother's going to have a hard time breastfeeding that child. Now, what do we see as a result of that? We see a child who most of the time ends up being formula fed, right? So suddenly, as the child's lymphatic system is just developing, and the mother is supposed to be providing all of these antibodies to the child starts being exposed to these common allergens. So cow's milk, for example. I personally strongly feel that the high rate of cow's milk sensitivity that we see today is because of the tendency, or the high rate, or the early exposure of infants being fed cow's milk, which have an entirely different nutritional profile than a mother's breast milk.
And in addition to that, 99% of it is highly processed and coming from CAFOs instead of farms.
Yes.
So it's damaged, it's toxic, and it's dangerous. We do have an infant formula recipe that you can make with cow's milk or goat's milk or sheep's milk, or I've even known people make it with camel milk, but with raw and only from pastured animals. And then there's the A1, A2 protein profile. We're looking for A2, A2. So that's a whole nother thing.
There's so much to consider. And that's where I feel like, we're really being hamstrung by these regulations and requirements for pasteurization and homogenization, because if we're talking to people, they're seeing incredible benefits from feeding their kids raw pastured milk, but the research just isn't there, right? We can't conduct the research because the regulations make it an unethical thing to do. And so you get tied up by these IRB boards, and I don't expect us to see these benefits coming through official channels anytime soon. But I absolutely recognize we're feeding our children dead milk, right? Like there is no biologically active benefit to this milk, that even if it's coming from cows, it may not be a mother's breast milk. It may not be tailored specifically to humans, but raw, pastured, untouched cow's milk still does have a lot of biological benefit that we're not going to see through something that's going to be pasteurized.
Right. And that's also why we can't really recommend even an organic, better baby formula, because the proteins have been denatured through heat. So we did put one of our babies on homemade cow's milk formula, and he did fine with it. Other people find that they do better with either goat's milk formula or, again, raw, or as I mentioned, camel milk. There's a variety. I actually have a couple quarts of water buffalo milk waiting for me in Florida when I'm there in a couple days. But the denaturing and the toxicity and all of that, coupled with, it's just completely unnatural. And we expect our kids to grow through babyhood on this garbage.
Yes.
I don't feed it to anybody.
Yes. And here we are getting back to Weston Price, that grain-fed diet, right? We were looking at pictures of humans that were fed grains.
Yeah.
That's one of the biggest differences, right? Between the first picture that you showed and the second picture that you showed was the grains. Well, now, I mean, what percentage of cows are raised and at least finished on grains, right? And that goes back to the concept of we are what we eats. And so if there are, lectins or inflammatory chemicals in the food that the cow is eating, that's going to be passed through into any byproduct of that cow. Yeah.
Yeah. And that's me. I will note that on the second slide here, that these brothers, being from the Outer Hebrides, consumed quite a bit of oats. But Dr. Price did a lot of research into how the oats were grown and all kinds of stuff, which was fascinating. They lived in a place where you pretty much had seafood and oats and a few seasonal vegetables and that kind of thing. So their diet was probably more limited than almost anyone else's, but they would have had a fairly high grain input.
Yeah.
Of course, naturally grown, not genetically modified, and not sprayed or toxic. But
we have a host of other issues that we're dealing with in our generation.
We do. I'm thankful that Dr. Price lived at a time he was right on the cusp of everything changing. And I'm sure he couldn't have even fathomed where our food production system was going to go, or the concept of a supermarket. They just didn't exist. And so people actually ate real food for the most part, even in America at his time, but they were eating canned food and they were eating processed grains and sugars. But now we're so much further down the line and things have become so much more difficult.
Yep. I think that, I speak with my wife about this on a daily basis these days. We are we really feel like there's a tide that's changing in terms of the consciousness and the awareness that the general population has over the importance of nutrition. And I think that, even right now within the past few months, there has been a wave of new awareness that I think, and we are really hoping, is going to drive just demand, right? That's what it really comes down to. Demand in the market for our foods to become more nutritious. more nutritious again. And I think that once we can open that door and have that dialogue in the open, we're going to see things like raw milk coming back onto the table as being something that's going to be more socially normal. Right?
Delaware just legalized it. Now we're
Amazing.
down to, I think, 4 states that are
Amazing.
not allowing it. We've, with the Weston A Price Foundation, we've really been hammering on that for 25 years now.
Awesome.
Yeah. So we've made a lot of progress, obviously, because when I first came on board about 23 years ago, it was only legal in 6 or 7 states, and now it's only illegal, I think, in 4. So that's fantastic. Yeah. But so we've got these children with these problems. Is there anything we can do nutritionally or lifestyle or with appliances or even better
so
exercises?
Yeah. So first off, so the child is born, you identify some ties, right? They should be revised as early as possible. So these days, reversing it is as easy as my recommendation would be to seek someone out, an airway trained dentist who utilizes a laser. Laser is going to make the procedure itself and the recovery much more simple.
Okay.
Airway trained because it's not just a cutting procedure. There is some exercises that are necessary afterwards to make sure that those tissues don't reattach.
Okay.
So you're going to want to seek someone out who has a good post-operative protocol for this. Now, the earlier the better, because whenever we're taking care of something early, we're not having to reverse so many downstream problems. If your child is older, around the age 4, 5, something like that, we may want to consider myofunctional therapy prior to a tongue tie release. So myofunctional therapy is basically physiologic therapy for the mouth and tongue to make sure that we're establishing appropriate muscle tone prior to releasing the tissues into their new range of mobility. Because what we don't want to happen is to release it and then it fall back and become worse because the muscle tone is not there to direct the tongue into the right position. We want to set the habits early. In those circumstances, I always coordinate care with a myofunctional therapist, and then I let her tell me or him tell me when is the right time for the tongue tie release. And then there is typically, whenever we're doing that, a post-operative protocol of myofunctional therapy that goes along with that as well to make sure that we are having the tongue move into the correct position. Now, if we're talking about, these things starting to get unwound, these problems starting to get unwound up to the age of maybe 4 or 5, a lot of times there's still so much bone growth and so many growth spurts that happen between then and the closing of the growth plates and things slowing down that we catch up without having to go towards something like appliance therapy. But appliance therapy is the concept that we need something to supplement the ground that was lost in the growth pattern. And so Dr. Browning and I are trained in physiologic orthodontics. So we can treat patients as young as 6 years old, all the way up into later adulthood. I have a patient in a functional appliance right now who's in her 60s, working on expanding the jaws and creating more airway space. But if enough growth has happened, it's always easier to unwind things whenever the child is younger and we have the growth momentum on our side. So there are particular types of appliances that we can use in children. In younger children, we can do either fixed or removable appliances. Fixed means that it's glued onto their teeth so they can't take it in and out, which compliance, we don't have to worry about them just not liking it and taking it out and refusing to wear it in that circumstance. And then, a removable appliance tends to be something that they would wear at nighttime, or just any time that they're sitting around, not in a social or eating, social circumstance or eating, where we can just be providing a little extra input to grow the jaw in the correct direction.
Something like a myo brace.
A myo brace, yep. Healthy Start is another example, and then there's another one called Tooth Pillow, which are all options. Those are off the shelf types of options that kind of a one size fits all. Here in our office, we are looking into them, but we take a more customized type of approach, more case specific, so that we're we design more custom appliances than the off-the-shelf type of appliances.
Okay. That's interesting. And I think we have a lot more to talk about. I have this whole list, thank you, and questions of my own, but I think for the sake of time, we should probably pause here for now and come back at a later date to discuss more. But I'm going to ask, if you were talking, and you are talking to, not me personally, but to young parents or people considering having children in the future, do you have just a few words of advice for them or for those who are pregnant now? What kinds of things should they be doing?
Absolutely. So first off, I will say that I think that if you follow the Weston Price Foundation's recommendations, you're not going to go wrong. That's going to be a really great way of setting yourself up for success. Genetic testing and identification of that MTHFR variation is an extra level of prudence that you could seek out. But if you are supplementing, just avoid synthetic versions of the vitamins. Do a little bit of research. Yep. Understand what the difference in name is between the natural and the synthetic versions, and seek out supplements that have the natural versions of the vitamins. Those are going to be the ones that are most biologically active.
Yeah, that is really important. And at a later date, we will do a show about labels. I recommend the book Beyond Labels by Dr. Sina McCullough and Joel Salatin. Mm-hmm. But there are other resources, and I'm wanting to talk specifically about that with anybody later, because it is really important that we understand that chemical versions of a natural nutrient are not the same as the natural nutrient.
Yep.
And also that typically, sometimes there's a place for something to be isolated, but typically we want to take the whole package because everything works synergistically.
Yes, I agree 100%.
Okay.
And then back to, what do we do, right? Like, what are we looking for? So from an early age, understanding what a tongue tie looks like. Mm-hmm. If you're having trouble with breastfeeding, seek out a dentist. Have the dentist do an evaluation, an airway trained dentist do an evaluation on your infant, and see if they would benefit from a tie release. In addition to that, keep eyes out for early signs of inflammation. Inflammation can be very subtle. They can be a chronically stuffy nose. They can be a tendency to breathe through the child's mouth. The mouth airway is a secondary airway. It is an emergency airway. It's a backup for the nose. Mm-hmm. If your child is breathing through their mouth habitually, that's not normal, and they should be seen by an airway trained dentist. ENTs are not trained to identify these types of problems, and they don't understand, or largely, there may be some out there, but in my general experience, they are not adequately trained on all of the developmental kind of things that get tied up into this. So an airway trained dentist, most of the time, they're going to have an ENT in their network that speaks the same language.
Okay, so an airway trained dentist.
Yes.
Just a side note that's related also is that I understand that when you breathe through your nose, that the air you inhale circulates through your sinus cavity and picks up nitric oxide?
Nitric oxide, yes. Nitric oxide is a peripheral vasodilator. It's an absolutely incredible molecule. There's a little bit of controversy surrounding it in terms of supplements to increase nitric oxide, but
Yes.
in its natural form, whenever you're breathing through your nose, you're actually stimulating your parasympathetic nervous system. What that is to say, your parasympathetic nervous system is your rest and digest nervous system. That peripheral vasodilation is something that relaxes your body, right? It lowers your blood pressure. It lowers your heart rate. If we're breathing through our mouth, we are not getting the stimulation of our parasympathetic nervous system the way that we should. And our body tends to stay in a more sympathetic state, meaning that we're in more of a fight or flight type of mode. It keeps higher cortisol levels, and that has implications on overall inflammation. If your cortisol is high, you're not clearing your inflammation appropriately, and you're putting additional stress on your adrenals, which can lead to big problems downstream as well.
Wow. The more that I learn and the deeper that we go, the more I just think about we are fearfully and wonderfully made. This is a complex system here.
Yes.
And not isolated parts.
Everything is connected, and it's amazing. And the more I go, the more I learn, the more I understand that I don't know. That's really what it is.
Yeah. Yeah. I mean, I don't know nearly what you do, but the more that I do learn, the more I know, wow, I've got so much more to learn.
Yeah.
And I appreciate that you are learning. I think probably for the same reason that I continue to strive to learn, and that is to help people. Yeah. The more understanding we have, the more that we can help people. So on that note, we're going to end for today. But we'll put in the show notes how people can get in touch with you and your practice. Mm-hmm. Do you have social media for people to look to?
We do. Let's see. We're on Facebook. We're most active on Facebook. We're trying to be more active on our Instagram. But the best way to get in contact with us is through our website. We have our phone number and all the different ways to contact us on the website. It's tuscaroradental.com.
Okay, thank you. And I'm sure people will be checking that out, and as I already have. And we'll end for now. But Brandon, I thank you very, very much for your time and sharing your knowledge. This is really beneficial. Yeah. And we want this to go far and wide, because what we've covered today, while it's just the tip of the iceberg, it is really important information that people, especially parents, need to know.
Yeah, I agree 100%. And I thank you for giving me the platform, letting me get the word out.
Oh, you're welcome. Happy to do so. Everyone, we'll come back next week with another episode, which actually next week will be Mandy Bloom, who is just about done with her PhD in clinical nutrition. And we're going to talk about medicinal uses of cannabis, pros and cons, and truth. And just truth. I want to get to the truth. So I'm looking forward to that show very much as well. But for today, we'll call it a day. And we thank you so much for tuning in. Again, I would ask that you like, subscribe, and share. Thank you very much, and have a great rest of your day.